Okay, today we're going to be looking at some treatment strategies for swallowing. And the first one that we're going to talk about is the Mendelsohn maneuver. And so the way that I would teach this to like a patient or someone so they could do it at home is I would tell them that first thing they want to do is have something to drink or eat so that they can take a bite or take a drink. So I would have you take a drink, and before you take a drink, I want you to know that when you take a drink, you're gonna hold it in your mouth and not swallow, okay? So just do that first part. I wanna take your index finger and your thumb, and you take it and you feel in your throat, okay? And I want you to feel around your Adam's apple. Okay, and now I want you to swallow and feel your Adam's apple, kind of where the highest point is right there. Good. And what you want to do is when it gets to that highest point, like right there, next time you take a swallow, so go ahead and take a drink and hold it for a second. You're going to squeeze whenever you swallow, so you can go ahead and swallow and squeeze there. And you want to hold that for 5 seconds. 1, 2, 3, 4, 5, and then you can let go and relax. And you want to repeat that every time you swallow. And the reason that you do that is so that your laryngeal elevation is going to be prolonged because you're holding it there to help your upper esophageal sphincter stay open so everything can go down. Okay, so that's the Mendelsohn maneuver. Now we're going to go on to the Masako maneuver, and this is a rehabilitative maneuver. So what we're going to do here is you're going to have your client stick their tongue out, just the tip of your tongue, so not all the way, just a little. Good, and just hold it in between your teeth and your lips like this. Kind of out a little further so I can see it. There you go. And you're going to try to swallow just your spit while holding your tongue in that position. So you just, good. And now you can relax. And you want to repeat that about 5-10 times a day. And the reason you want to do that is because it improves interior movement of the back pharyngeal wall during the swallow so that you can increase range of motion of the tongue base and the throat muscles. So everything just moves better, and you can do that a few times a day to kind of strengthen everything. The next one we're going to do is called the chin tuck against resistance, and this is a postural maneuver. So what you want to do is you want to be seated just like we are. Get your spine straight. So you would want to have really good posture for this one. And the reason that we're doing this is to just strengthen the suprahyoid muscles for swallowing. So what you want to do is just sit with your back straight, like I said. And you're going to take a resistor, and you can use a towel. We're going to use a towel today. There's also a device that you can use for the chin tuck, or you could use like a small ball. But we're going to use a towel for today because that's what we have with us. So I'm going to give this to you and instruct you how to do it. So what you're going to do is you're going to place that against your neck. Just place it there for now. And then you're going to press down into it with your chin. There you go. And you can take your hands away if you need to and hold that for 1 minute. And we're not going to do the whole minute on here, but you would hold that for a minute, and you could put it on your timer on your phone or whatever you need to. And then you want to keep that same posture. You can take the towel out. Yeah, remember to keep your back straight. And you can let that towel come out. And you want to relax. There you go. So you want to relax for about another minute, and you can repeat that about 2 times. 1 minute holding the resistor on your chin, and then 1 minute relaxing. So 1 minute on, 1 minute off. And then next you want to take that towel again, back where it was. Hold it just for 3 seconds this time. 1, 2, 3, and then you can let it go. And you can repeat that up to 30 times with rest in between. So it's just kind of strengthening those muscles. There you go, thank you. All right, next one we're gonna do is just called head rotation, and this is also a postural maneuver. This is used usually when there is unilateral pharyngeal weakness, so one side of weakness in the pharyngeal area. So this one's pretty simple. What you wanna do, so if a patient is weaker on one side than the other, so say you're weaker on your left side, so you want to turn your head to the left, this is my right, for when you swallow. And you'll just swallow by turning to your weaker side. So you just want to swallow good. And the reason that we do that is because it narrows your pharynx and closes off the piriforms on the side that's sending the bolus down. So it's sending the bolus down the stronger side because you're closing off and turning to the weaker side. So it's forced to go down the stronger side of your pharynx, which forces it down with more pressure, and then there's less residue usually after the swallow. It reduces that. So that's the reason you would use head rotation. And then our last one is actually just called carbonation. And this is just a compensatory strategy that you can use with carbonated liquid. So you could just take a drink of this carbonated liquid. And the reason that you would do this, you can go ahead and take a drink, is because there has been some research saying that there's been decreased penetration and aspiration with carbonated thickened liquids. So if you just use some carbonated water, maybe some sodas, things like that, it could decrease that penetration and aspiration because a smaller bolus, it can compensate for an issue with the timing of the pharyngeal response. So yeah, I think that's all our strategies. Thank you to my patient today.